Now here's something I didn't realize. There are nearly 300 different diagnoses of headaches.
And in West Michigan, a surprising number here, more than 150,000 people live with migraines, but there is hope.
Dr. Larry Charleston IV, a neurologist with the Spectrum Health Medical Group, is here today to talk about headaches and how you can get information. Okay, so this is really interesting because this is something that on some level everyone can relate to.
Right. Well, thank you for having me here. Yes, there's a very common headache that a lot of people have, and they usually don't seek medical attention for, and that's tension-type headaches. However, there's over 36 million people in America that have a migraine disorder.
And when you talk about a migraine disorder, what's the difference? Is it the duration or the frequency or the intensity of these?
All of the above.
Okay, all right.
All of the above. And so migraine has a specific diagnostic criteria, and usually these headaches are by definition debilitating. So whereas a tension headache may not be that debilitating, you may be able to take an over-the-counter medication for. Migraine may be less so. And that's what people seek medical attention for.
Let's talk about causes, because you know we'd all like to know really what causes it, because when we have it, we're in pain, our world seems to be like, and so there are different things that can basically trigger headaches.
Right, so there's a difference between causes of the headache itself and triggers, okay? So causes are it's more neuronal, more brain. I mean, this is a brain disease, so pain plus brain equal migraine, okay? We can kind of think of it like that. However, there may be things that trigger it, like different foods and different smells, and sometimes being really sensitive to light and stress.
So can this be something that you have at different stages in your life? Like, I'm not someone who typically gets many headaches, but as I maybe go through menopause or you go through your childbearing years, is it something that you can eventually develop?
Well, migraines are most common during childbearing years, and out of that 36 million Americans, about 75% of them are women in childbearing age. Okay. So yes, and there can be that component, and there's also the hormonal component. Some people get headaches that are worse with their menses, and so there is a hormonal component to it as well. So yeah, it can fluctuate too. It's an episodic type of chronic episodic disorder.
So more women than men then?
Yes. For migraine, yes.
Okay.
For cluster headache, remember there's 300 different types of diagnosis.
Okay.
Cluster headaches tend to be more common and more frequent in men.
You know, it's really interesting. Are there things that we can do about these headaches that we get, about the migraines, about anything small, too large?
Yeah, absolutely. Well, the number one cause of headache across the world is dehydration. So,
really?
Increasing your fluid. Yes, absolutely.
Oh, my word.
Absolutely. I sometimes tell patients, it's like, well, yeah, I had a couple of drinks, or maybe more than a couple of drinks, and the next day I got a headache. Well, the main cause of that is likely the dehydration. I mean, there are some things with alcohol as well, but there's a lot of dehydration. So if you if someone I don't know, I wouldn't speak for myself or anything, but if someone have a lot of drinks and then they go to the bathroom a lot, and so what happens is they're peeing out a lot of water and things like that. So
that's something you can control.
That's something that you absolutely can control. Like I said earlier, stress is also a trigger, can be a trigger, and so learning how to deal with stress would be very good to avoid your triggers. I often tell patients that they really need to find out what their triggers are if they can, and definitely avoid those triggers.
It sounds like this is a topic that we're just kind of scratching the surface of today. You actually have some great information available that you really want to share with people, because maybe if it's not necessarily ourselves suffering with these, we all know someone who suffers from headaches, migraines on a regular basis. You have a great seminar coming up.
Yeah, so we have the Doctor Dialogue series, which is part of the Spectrum Health series. The Doctor Dialogue, Conquering Headache Disorders. is going to be next Wednesday at 7 o'clock at the Pinnacle Center. So there we'll get a chance to dialogue a little bit, and so people can ask they can ask their questions to me, and hopefully we get some great answers, and people have a better understanding. It is a disorder that is often neglected. Headache disorders in general are often neglected.
Yeah, and so people should put this on their calendar. I know a lot of people will be attending this, and so do you need to sign up to attend this? You do, don't you?
I believe there's some type of registration as well.
Right.
And so I think that's really important. I mean, we need to know how many people are there for space and all that type of things like that. We want to accommodate as many people as possible.
Wow.
So I'll take that note back. Yes, please, please register.
Just how many questions we had for you, I'm sure very much, because this is very debilitating for a lot of people. Thank you so much for coming in.
Thank you for having me.
We love how accessible you make it at the Spectrum Health Medical Group. All your doctors, so easy to share, get that information to hopefully help all of us lead healthier and more comfortable lives.
Absolutely, absolutely. Thank you so much.
We'll be right back.